10 minutes.
Good morning, everyone. I'm so glad to be here. I'm delighted, I'm excited, and it's a pleasure to co-host this most important event. For the Institute of Global Surgery, it's a real honor to be able to help and facilitate in any way this event. So welcome. And I hope that during the day, everybody will have the opportunity, as Nadine said, to mingle, to network now and at the pub, so that we actually learn from each other and get the most out of the meeting. I want to take the opportunity to introduce you to the Institute of Global Surgery, of which I am very proud to have been chosen to lead it, and I've been here since a year and a half ago. This is an amazing group of individuals who are working tirelessly to develop all kinds of educational training programs and research. We have a new addition, Ellen Peterson, who is one of our research fellows who just joined us, and the PhD student that is working with her. So you will see some of these people here today. Please interact with them, and I hope they can have the opportunity to share with you all they do. I also want to take the opportunity of the podium and abuse of Nadine's generosity of the time to actually make an incredible announcement. We actually today are officially inducting a new group of members that we have called the collaborative faculty members. These are individuals who, even though they don't belong to the Institute of Global Surgery, they have by themselves participated in many ways in many activities in global health. And as a token of gratitude and recognition, the Institute has appointed them as collaborative faculty. And the first person is Professor Jean O'Sullivan, who is a consultant in emergency medicine at Tallaght University Hospital and a clinical professor of emergency medicine at Trinity College, Dublin. Jean has extensive experience in global health education. She actually developed a training course on the skills for trauma, and she has been teaching with her organization trauma skills all over Africa. She will be in Botswana at the end of this year, but she has worked in Kenya, Zambia, and Malawi. And she was recognized with the William Rutherford Humanitarian Award by the Royal College of Emergency Medicine in London, and also by a humanitarian award in global emergency medicine here. So, Jean, you're welcome. Please stand up. This is just to welcome you and appreciate. McDermott O'Flynn, I don't think he's here today, but we want to recognize him as well. He is a current director of the Myth Foundation. He worked for many, many years at the Institute of Leadership and Management, Healthcare Management at the Royal College. And Mr. McDermott O'Flynn has been the key example of making a change that is sustainable. He started with the trainer programs of COSEXA, and now this program is totally independent and autonomous. They don't need him anymore, which is exactly the kind of intervention we want to do in global health. And finally, we want to also welcome Professor Fergal Quinn, who is a pediatric surgeon, urologist, who is retired, but he has been instrumental in teaching pediatric surgery in Africa, and now he's helping us, monitoring and coaching and mentoring PhD students in pediatric surgery. As you know, the burden of disease in children and low-income resources is huge. So we want to welcome them all. I have a few minutes left, and I just want to tell you a couple of thoughts that I want you to think about over the course of the two-day event. We are part of the School of Population Health, and this is an amazing team of professionals that are all working in health in Ireland, in Europe, and in global health. And we are experts in these areas, and this is what we propose we do to actually make change and to change and improve equity. Understanding, though, that even though we are health professionals and educational professionals, we cannot do this with some sort of economic development, and that is the goal number one. How do we get rid of poverty? I cannot miss the opportunity to talk a few minutes about what COSEXA and the Royal College of Surgeons had done over the years. And in 2 minutes, I will tell you, this is a map of the 142 training hospitals in Africa that, with COSEXA, the Royal College and the Institute of Global Surgery, has participated in creating a college of training surgeons without walls. This is an amazing feat. Think about all the diversity of a continent like Africa, different languages, religion, costumes, economical challenges, yet these individuals all train and become surgeons across these many walls, across these many countries with no walls. And this is perhaps one of the things that I believe is the greatest impact. And this partnership, remember that I told you how important partnerships are, has become the largest contributor of workforce development in Africa. This is the last graduation. We will be there in December again. This will be the 25th anniversary of COSEXA, and the Royal College and the Institute will be there celebrating with them all these accomplishments. So I couldn't let this opportunity of expressing and telling a little bit about the Institute and some of the impact that the Institute and Irish aid and the contribution of Irish taxpayers to actually show that this is a high impact activity of which everybody here in this room should be proud. When we talk about equity and we look at this cartoon, we go all over the internet understanding, well, that's a very interesting thought. And many people have actually modified these, go through crude realities to the left to sort of maybe at some point we'll get justice at the very other side of the spectrum. But really what we in this group need to do is to figure out what does fostering mean and what is it that we're going to put in these boxes, isn't it? If we are actually going to change equity, what is it that we, as an individual, our institution, our educational affiliation can actually put into there? We said we do this, of course, this is what we do, this is what we're good at, but I think the next generation of sort of remedies to improve this equity has to be economical development. And even though we're not economists and we are not investors and we are not the policymakers, we need to connect with these people and figure out how what we do can actually be supported by economic development. Otherwise, I'm not sure that we're going to gain what we want. And that's my message for today. I appreciate the invitation. We are tremendously excited to be here. I hope we have all day to talk and learn from each other. And again, welcome and thank you very much.